So this topic continues with the physiological changes and specific physical problems in geriatric practice. When we look at the statistics of elderly populations, so Canadians age 65 and older will rise from 14% in 2010 to 25% by 2036. In 2014, 14.5% of the US population was aged 65 or older and is projected to reach 23.5% by 2060. And when we look at the statistics in Malaysia, so in 2012, 2.4 million people were aged above 60 plus. And when it is estimated that around 2030, 4.9 million people will be above the age of 60 plus. And when you look at 2050, it is estimated that 14.7 million people will be above the age of 60 plus. So when you look at the change, so if you want to reduce the consequences of elderly populations, we need to have a change. So life is a process of continual change, and age related changes occurs in many levels. So we have four levels. One is about biological level, so where family or genetically the persons will be included. Second one will be about the psychological aspect. So third one will be with the physiological changes that takes place inside the body, and the fourth one will be the functional level. So these are all the age related changes that takes place in this four level: biological, physiological, psychological and functional. So during childhood there is a slow decline in function. So as the person gets age, the hemostasis is maintained at a level of decreased function. So what is aging? So already we know about aging. So aging is the inevitable chronological changes from year to year, right? It can be defined from both biological and psychosocial perspectives. So biological aging, which involves changes at a molecular, cellular and organ level, is considered as biological aging. Starting at about the age of 30, aging in human results in an internal physiological deterioration. So biological aging is genetically determined and environmentally modulated, as we discussed in the previous lecture. So the third one is cellular senescence. So cellular senescence is the process by which a cell loses its ability to divide, grow and function, ultimately leading to cellular death. And when you see about the fourth point, aging can be characterized by the acronym which is termed as CUPID, meaning that aging is cumulative, universal, progressive, intrinsic and deleterious. So first one we will see about Cupid. Cupid means C, which stands for cumulative. So cumulative means the effects of aging are irreversible and accumulate over time is termed as cumulative. The next one is about B, which stands for U. It is considered as universal. So all human age, which make this phenomenon as an universal. It is considered as a universal process. So for all the human beings, it is considered as one of the universal way of getting old. The third one is aging. So aging is an unidirectional process. For example, a post-menopausal woman cannot become ovulation again. So it goes in a unidirectional way. The fourth one is because even under the best environmental conditions, an individual ages, aging is intrinsic to the organism. And the fourth is deleterious. Fifth is deleterious, means that aging is harmful, resulting in decreased vitality and an increased vulnerability to disease and environmental stresses. So when you look at the statistics, around 1.1 billion adults have raised blood pressure, less than 1.5 have it in under control. So when you look at the statistics on the causes of death in Malaysia in 2017, so most of the persons, the ischemic heart disease was considered as one of the principal causes of death in 2016. That was around 13.2% with a decline of 0.5 percentage compared to 2015. When you look at females, pneumonia was the principal cause of death among females in Malaysia. So changes of aging. So when you see about the changes of aging, aging and diseases are not synonymous, right? And most of the geriatricians do not view aging as a disease because aging is a natural process, and unlike diseases, aging is universal. So aging is a diverse process in that it differs not only from individual to individual but also among the organ systems of an individual. So biological aging and chronological age are not the same. Aging alone generally does not cause any symptoms. So some changes previously attributed to aging are now thought to be related to the lifestyle variables. So in that, genetic makeup may only account for 25% of the variability of human longevity, with much of the health and well-being determined by the environmental factors. Aging may be slowed to some extent by maintaining a healthy diet, exercising, and engaging in other healthy lifestyle habits. When you look at this graph, so when the age increases, the person will becomes less fit and the amount of function will not be within the control, and the patient will tends to have a loss of function due to aging there, right? So that is commonly seen in most of the elderly persons. So in order to regain all these changes, so the person will be advised to undergo a physiotherapy program, or a proper exercise program has to be advised to the patients in order to get rid of all these changes. So loss of physiological function and amount of function must be within the control, and the person in order to maintain a maximum fit level. So physiological changes in aging. So when you look at the physiological changes in aging, is considered as an individual experiences which depends on the genetics, lifestyle changes, and the environmental factors. So changes from disease and lifestyle choices are not considered as a part of normal aging. So first we see about the changes that takes place in the body composition. So when you look at the body composition, so normally most of the elderly persons, their lean body mass decreases because of the muscle loss and some loss of the bone. And at the same time, all individuals will also tends to loses their height. So on an average, individuals will lose about 5 centimeter in height by the age of 80. And there are various factors that contributes to the loss of height. So they might be, one is of changes in posture. The second is due to vertebral compression. Third is compression of the intervertebral disc. Fourth, due to an increased curvature of the hip and the knees. And fifth is due to the decreased lower extremity joint spaces. And sixth is due to the flattening of the feet, and which it may affect how clothing fits. And normal changes in the height from aging usually do not cause any health related problems. So when you see about the body composition changes with the aging, so most of the changes in the body composition will be most four. One is about decreased in the lean body mass, second will be decreased muscle and bone mass, and the third one is decreased total body water, and fourth is increased percentage of the body fat. And when you look at the clinical impact due to the changes in the body composition or changes in drug distribution, the person will tends to have a decrease in the muscle strength, and there will be also greater risk of falls, and greater risk of fracture will be there, and at the same time greater risk of dehydration will tends to develop due to changes in the body decomposition. So the next is due to the dermatological changes. When you look at the dermatological changes, skin and the hair provide the most visible clues to the aging process. The second is epidermal cells turnover decreases by about 10% per decade, where there will be a slowing of the skin's healing response to injury will also decreases. When you look at the individual's age, the skin thins and thinner skin may allow more moisture to escape, and along with a decrease in the functioning of sebaceous gland and sweat glands contribute to dry skin. So the number of melanocytes also decreases, making the older individuals more vulnerable to ultraviolet damage. So older adults are greater risk of skin cancer. The loss of melanocytes in hair causes graying of the hair. A decrease in the number of Langerhans cells reduces the skin's immune response and increase the incidence of skin tumors and infection. And at the same time, vitamin D production diminishes due to aging process. Overall decreases in hair follicles thins hair along with redistribution of the hair, and male tends to loses body hair and experience hair loss around the temples. Male pattern baldness is common with age. So in men there may be also an increase in hair growth on the earbows, ear as well as nose. When you consider women, they might be having thinning hair and a receding hairline will tends to develop, and a loss of body hair will be there. And in women there might be an increase in facial hair will also develop. Skin cells produces less collagen, and the dermal epidermal junction will tends to flatten, making the skin more fragile and easier to tear. So this process also reduces the amount of nutrients available to the epidermis, impairing skin repair. So toenails grow slower, becomes thinner and more difficult to cut with aging process. A loss of fat padding on the feet predisposes elder to the callus, corn, foot pain and ulcerations. 1 in 3 people over the age of 65 have problems with foot pain, stiffness or aching feet. Most common foot problems in geriatric patients are: one is bunions. Bunions are the most common foot problems. Callus or corns will be formed, hammer toes will be present, toe nail problems will be there in individuals, neuropathy will be more commonly seen, and apart from that, foot deformities due to arthritis or gout, and at the same time heel pain will be also commonly seen in elderly due to spur formation, and it can be seen with the help of an X-ray investigation. Musculoskeletal changes. When you look at the musculoskeletal changes, most commonly muscle strength there will be a decrease, and the endurance level will also decreases in individuals. And sarcopenia is the most commonest disease you can see due to the changes in the muscle strength and the contractile strength that occurs with age. Sarcopenia is associated with increased fatigue, frailty or an increased risk of falling, and can compromise the functions of the older adult. The respiratory muscles and the rib cage are also affected by aging, decreasing the efficiency of breathing. Alterations in muscle function in the gastrointestinal tract and urinary tract increases the risk of constipation and bladder dysfunction. So bone loss is one of the universal aspect of aging process, starts in 30s, and the degrees of bone loss occurs at a highly individual rate and is influenced by diet, exercise and lifestyle. So with aging, there is decreased water content in the cartilage and more cross-linking in the collagen fibers, which impacts the ability of the cartilage to cushion pressure on the bones. So changes in cartilage are the underlying causes for osteoarthritis. There are also similar changes in the tendons and ligaments which can contribute to decreased flexibility and mobility common to older adults. There is about a 30% decrease in the bone marrow cellularity, and 10 to 20% of the women have a hemoglobin of less than 12 gram per dl, and 10% to 20% of the men have levels less than 13 gram per dl. The respiratory system changes may be the system at the greatest risk from environmental damage. When you look at the age related changes in the respiratory system might be due to the environmental factors such as air pollution, occupational exposure as well as smoking. Usually, age-related changes in the respiratory system do not significantly impact performance of normal daily activities. However, there will be a reduced respiratory reserve for tolerating high demand situations such as strenuous exercises or pulmonary function. So, respiratory system changes include the trachea and the lung airways enlarges with age. There might be a weakening of the respiratory muscles and the chest wall will be stiff, which reduces the effective ventilation. So the number of cilia will tends to have a reduction and their activity will also reduces. The cough reflexes reduces with age, impairing the effective coughing mechanism. So the nasal and the pulmonary mucosa which produces less IgA antibodies, impairing the ability to neutralize the viruses. Although the number of alveoli do not change significantly with age, alveolar structure and function is also altered. An increase in cross-linked collagen and fewer elastic fibers give the lung less elastic coil, and when you look at the spirometric changes includes a decrease in forced vital capacity, and at the same time there will be also an increased residual volume. From ages 30 to 80 years of age, most of the individuals there will be a decrease in the vital capacity, and at the same time the forced expiratory volume will also decreases about 30 ml per year after the age of 30, and residual volume increases by about 50%. When we look at the gastrointestinal system changes, so aging of the gastrointestinal system causes fewer serious problems than most other organs systems. Older individuals makes less saliva and more frequent complaint of the dry mouth than the younger individuals. So while there might be a modest change in taste, the taste and the smell are linked, and at the same time there will be a loss of smell along with the diminished saliva. In this one reason, older adults may complain that food are no longer taste good. When we look at most of the elder individuals will tends to say that they have an altered taste and smell, and the stomach will also secretes less hydrochloric acid and produces less intrinsic factor which is needed for the absorption of vitamin B12. While there is a decrease in the production of gastric and pancreatic enzymes, there is no appreciable change in the fat, protein or carbohydrate digestion. So hepatic blood flow, the size and the weight will also decreases with age, leading to less efficient elimination of drugs which maintains the overall function. And the elderly persons will also tends to have a decreased interstitial muscle tone which results in slower peristalsis and increased transit time, and at the same time the older individuals are also under the greater risk of constipation. Next, about the urinary system. So urinary system changes, the kidneys become smaller with age, and there is about a 20% to 30% change in size by the age of 90. The changes in the size as well as the primarily in the cortex where the number of glomeruli decreases by about 30% to 50%. There is also a gradual decrease in the glomerular sclerosis. There is also a loss of renal tubular cells, and a thickening of the tubular walls will tend to develop, and which impairs the kidney's ability to concentrate as well as dilute the urine. Renal blood flow which decreases with age, and the glomerular filtration rate will also declines at about 1% per year starting at about the age of 35, and by the age of 75 the glomerular filtration rate may be about 50% reduced than that in an young adult. The bladder, ureter and the urethra are muscular structures that tends to loses the tone and elasticity with increasing the age. The loss of muscle tone may lead to incomplete emptying of the bladder, and a greater risk of infections in the elderly persons. And in males, prostate enlargement may contribute to incomplete bladder emptying in men. Bladder capacity may decline from about 350 to 500 cc to about 200 to 300 cc in the older age. This causes the need for more frequent urination as individuals age. Next, about the cardiovascular system. So most of the anatomical changes, which includes the following. One will be, there will be an increase in the left ventricular wall thickness, and in fatty filtration will tends to develop. And 2, there will be a decreased contractile strength of the heart muscles. 3, the heart valves become hardened and thickened, making them to less efficient. And 4, the pacemaker cells will diminish in number, and there is an increased fat and fibrous tissue infiltration of the conductive system will tends to develop. So when you look at the blood vessels becomes thicker and less elastic, impairing their ability to expand and contract. When you look at the principal changes in the cardiovascular system, as mentioned in the previous slides, there will be an increase in the stiffness of the blood vessels, increased stiffness of the myocardium, decreased beta adrenergic response will reduces, there will be a decreased function of the SA node, and at the same time the endothelial cell function will reduces, and at the same time there will be also a overall reduction in the cardiovascular reserve will also tends to develop in the elderly persons. So the next about the nervous system. When you look at the nervous system, the brain loses neurons with age, and about 20% of the brain weight is lost by the age of 80 or 85. So lipofuscins accumulates in the nerve cells as individuals ages. There is also some accumulation of neurotic plaques and neurofibrillary tangles. These anatomical changes are also characteristics of Alzheimer's disease. So if a person tends to have an accumulation of neurotic plaques as well as neurofibrillary tangles, the person develops Alzheimer's disease, but with present to a much greater degrees in those individuals with Alzheimer's disease. So CNS changes, normally in most of the elderly persons there will be a decrease in the brain mass, decreased dopamine receptors, increased parasympathetic responses, slower reflexes, and decrease in acetylcholine. So if these are all the CNS changes, the clinical impact will be on atrophy can be seen on the CT scan as well as on the MRI, and at the same time tendency towards Parkinsonism, gait changes will tends to develop, severity to anticholinergic drugs, and the patient tends to develop tendency to falls, and at the same time diminished reflexes on examination can be seen, and 2-point discrimination will be also very poor in elderly individuals. So when you look at the cerebral blood flow will also decreases by around 15 to 20% during the age of 70, and there are also age related changes in the neurotransmitters. There will be a decrease in the dopamine content, and the acetylcholine receptors will decreases, and decrease in the total amount of acetylcholine will also be present in the elderly persons. Physiological changes related to taste and smell. So when you look at the evidence regarding the change in taste with aging is unclear, but when you look at the data suggests that there is also an increase in the threshold for detecting sweetness and salt. Uh, the problems related to the change in taste are loss or increased appetite, loss because of no taste, increased intake to achieve some taste, and complaints about how food tastes, mistaken identity of the food, cannot identify the spoiled food, and excessive seasoning which increases sugar and salt. So when you look at the vision changes, the tissues around the eye gets atrophy, and the muscles get weakens when the age gets increased. The upper eyelid may drop, and the lower eyelid may turn either inward or outward. The tear production which decreases, and patients may complain of dry eye, and which is common among older adults. The iris become more rigid and the pupils become smaller. Eye color may also fade in some of the elderly individuals. The cornea becomes thicker and less curved with age. Presbyopia is one of the age-related visual changes that tends to gets affected in most of the individuals, which becomes more difficult to focus on near objects. Retinal changes include a loss of rods and cones and a decline in light and dark adaptation. So hearing changes, the auditory canal gets atrophied with increasing age that results in the thinner canal walls and decreased sermon production. The tympanic membrane thickens and may appear duller and whiter when compared to young adults. Ossicular joints can degenerate, contributing to hearing loss and aging. There is also a loss of hair cells in the organ or cortei, and combined with the loss of cochlear nerve cells contribute to presbycusis, a general term that describes the hearing loss reported in most of the older adults. When you look at the immune system changes, the efficiency of the immune system will decline when the age increases, and it is also often associated with an increased susceptibility to infection, reduced efficacy of vaccination, and an increased inflammation and level of inflammatory markers. The thymus gland, which is important for activating T cells, gets atrophied when the person gets an increase in the aging. The number of T cells will also gradually decreases and a peripheral T cell response slows with aging process. When you look at the endocrine system changes, there is a progressive decline in carbohydrate tolerance with increasing insulin resistance. The level of aldosterone, renin, calcitonin and growth hormones decreases with age. The level of thyroid hormones, that is T3 and T4, cortisol, insulin, epinephrine and parathyroid hormone levels remains the same, and only there will be a slight decrease when the age increases. Follicle stimulating hormone, luteinizing hormone and the norepinephrine levels increases with age, and when it comes to women, estrogen and prolactin levels decreases after the menopause. The testosterone levels decreases with age, and there is also a blunting in the diurnal rhythm of testosterone levels that is also noted in younger men. Reproductive system and sexual changes. As a general rule, everything tends to reduces when the age grows. So when you in men, the following are observed: more intense stimulation is needed for erection, and erections are less firm. Ejaculation takes longer and occurs with less volume and intensity. There is a longer refractory period in males. The testes continue to produce sperm, but the rate of production slow, and the epidermis, seminal vesicles and the prostate gland loses some of the ability to produce the fluid that carries the sperm. Men can father children into their 80s also. In females, estrogen dependent changes such as thinning of the vaginal wall will tends to develop. A decrease in the vaginal lubrication will also be present. There is also a slower reaction of the clitoris to stimuli will tends to develop. There may be a longer refractory period, same as in males. And when you look at the common potential treatable conditions in the elderly, are depression is commonly seen in most of the elderly, and apart from that, diabetes is there, food disorders, hearing and vision disorders, hypothyroidism, iron deficiency, anemia, nutritional deficiencies, oral disorders interfering with eating, cardiac failure, chronic obstructive pulmonary diseases, basal cell carcinomas, falls, osteoporosis, polymyalgia rheumatica and temporal arthritis, Parkinson's disease. So these are all some of the most commonest treatable conditions that can be seen in most of the elderly individuals. So the integrated model of quality of life is, So normally if a person tends to have any type of disability, the person will be provided, or the person will be concentrated more on the physical well-being of an individual, psychological well-being of a person, social well-being of an elderly person, spiritual well-being, cognitive well-being, and environmental well-being. So all these components has to be introduced to the elderly population in order to have a higher quality of life. So there are two references for this topic. Thank you.